time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, my friends, we have heard a lot about lupus in the recent times, and we're also going to have a great event happening on July the 24th. Now, before I get into talking about July 24th, let me talk about lupus a little bit. And the person who is here has been a great spokesman for the Lupus Foundation, Cynthia Dolon. We'll get to her in a minute. But I'm going to be joined a little bit later on the phone with Dr. Andrew Newberg. Now, folks, this is for everybody. This is not for people who have all lupus, but Dr. Newberg is the Director of Research of Alternative Medicine at the Jefferson Hospital. Now, he has been on the Good Morning America, Nightline, CNN, ABC's World News Tonight. His research also appeared in the Newsweek, Time, the New York Times, Los Angeles Times, and the Oprah magazine and the Reader's Digest. The man is a genius when it comes to alternative medicine. His theme for that event, which will be on Thursday, July the 25th, is the connection between God, your brain, and healing. Okay. He also has many books. You got to go and Google this guy because he has a book that I think is fantastic. It's called "Words Can Change Your Brain: 12 Conversational Strategies to Build Trust, Resolve Conflict, and Increase Intimacy." Well, folks, this guy is a genius, and we'll have him on the phone hopefully a little after the break. But first, let me welcome a good friend of ours, Cynthia Dolon. How are you, Cynthia?
I'm doing good, Sammy. How are you?
I'm doing fine.
It's a beautiful day today.
It's always a beautiful day.
Absolutely. Positive mindset. That's what we have to have.
It's a beautiful day no matter what day it is. If God gives you the day to get up, you better enjoy it, right?
Absolutely.
Cindy, you have lupus.
Yes, I do.
Okay, and for those people, you know, and you are a very intelligent person.
Well,
okay?
thank you. I appreciate it.
You are, and you are thinking of becoming a doctor, I think?
I'm working on it right now. I have a straight A average. I'm taking my science courses, and I'm going to take my MCATs and go off to medical school.
Lupus, what about it? Tell me about it.
Lupus is an autoimmune disease. Basically, what that means is your body attacks itself. Our immune system is built to fight off bacteria, viruses, and infections. And when it works good, it works fantastic. However, sometimes it gets messed up because of genetics, environmental stuff, medication, or whatever, and it starts to attack itself. Your body no longer recognizes its organs as being a part of itself. And autoimmune diseases range from multiple sclerosis, Crohn's disease, myasthenia gravis, asthma, to lupus. And where it's at, that's what organ it attacks. Lupus is systemic. It attacks more than one organ. It affects your brain, your heart, your lung, your kidneys, your whole entire system. Anything could be involved. You know, it just attacks everything. Blood vessels, you can get low platelets from it. The symptoms range from fevers, rashes, that's like a butterfly rash across the nose and cheek, fatigue, joint pain, muscular pain, blood variants that are off. You know, it affects your circulatory system. You just start bruising all over. There's a lot of blood tests that they can run, and they come and go in their positivity. So you could get through on one day, and it comes back negative, but if you came the following week, it'd be positive. It's a very hard disease to diagnose. It usually takes about 3 to 4 years before a person gets a proper diagnosis because Lyme's disease and other things can also mimic the symptoms of lupus.
How did you know you had lupus?
Well, I started having all these different types of symptoms happen to me, but what really got me to get to the doctors when I started to have low platelet counts, blood counts that came back, at low levels. I started getting fevers that I couldn't understand, rashes all over my body, joint pain, and then all my moods were all over, and I was getting all these psychiatric symptoms. I knew something was wrong, and I wasn't quite sure what it was, and I went from doctor to doctor to doctor to finally one of the doctors in town said, you know, your liver enzymes are way off. You don't drink, and there's no explanation for this. We're going to send you down to Johns Hopkins. When I was down there, they ran a ton of blood work on me, and they found that my ANA was extremely high, and my SID rate was very elevated, and that's how the first diagnosis of lupus came about. It was down at Johns Hopkins University.
Are you on medication?
Yes, I'm on steroids. Mm-hmm. And unfortunately, with steroids, sometimes the side effects of the drugs are worse than the condition itself. It's a delicate tightrope walk with lupus. You have to decide between are the symptoms severe enough to treat, or am I better off dealing with the symptoms because the medications actually are just as dangerous as the condition itself. I have developed diabetes from the steroids that I'm on, and you could tell I am not anorexic looking, but I'm alive, and that's all that matters to me. My platelets were very, very low. I almost died. I bled from every part of my body, and if I was not placed on steroids, I wouldn't be alive right now. But there's a lot of drugs that have a lot of very serious complications to them. But the problem is, they do work. People can live longer lives than they ever did with lupus and these other autoimmune diseases. The drugs are effective, and we're seeing success in that realm. We've had some new drugs come out on the market in the last couple of years, and there's promise here, okay? But the problem is there's a lot of side effects to these drugs, so you have to kind of figure out is if it's not a life-threatening symptom, are you better off just dealing with the symptom or treating it? That's the delicate balance with lupus.
And you've been able to balance yourself.
Absolutely, and it's a day-to-day struggle because you have to kind of assess yourself from day to day. Your symptoms could be great you could be great one day, and the next day you could be flaring up all over the place.
And with lupus, as we discussed before, if sometimes people who had lupus, they thought they were a little crazy.
Right. Oh yeah, psychiatric symptoms are a big part of it. Yeah. You can have memory loss, you can have confusion, you can have psychotic symptoms. You can actually come across as being schizophrenic. You can have depression, mood swings, stroke, seizures, anything. The brain can be very much involved. As a matter of fact, when they do MRIs of the head, you could actually see white matter lesions, which are similar to multiple sclerosis on an MRI of a lupus patient, stroke symptoms. A lot of things will show up, but there's a lot of symptoms of lupus that are cognitive that don't show up on the brain, soft symptoms, and they're even harder to treat because you're not quite sure what's going on with the person. Also, depression could come from a coping situation. You're trying to deal with the lupus, and also the medication could cause these symptoms too. So you have to have a very intelligent physician who can tease out in his mind what exactly going on. Is it from the condition, the cerebritis of the brain? Is it from the medication? Because steroids can also give you those kind of symptoms. And also, is it just from coping with the condition? Sometimes you'll develop a depression because you have a high pain situation, or you have a situation because you have to change your lifestyle. So it's kind of hard to figure out where the cognitive symptoms are coming from.
This foundation that you're involved with in this event that's coming up on July 24th and 25th.
Right.
Now, is this open to the public?
Absolutely. We embrace the public to come. We want the public to come. Okay. That's what we're trying to do today.
Now, Dr. Newberg is going to be talking about another area about here because he's the director of alternative medicine. Right. And the theme that he'll be speaking about at this event will be the connection between God, your brain, and healing.
Right.
Okay. How important in your life, you're living proof of lupus, has been this connection between God, your brain, and healing?
Honey, I wouldn't be here without God. God is central of everything that I do in my life. And he guides me to where I need to go. I had a lot of miracles happen with my medical condition because of God. There was situations where my platelets were down, we couldn't figure out what to do. People prayed with me, and things would just work out. The fact that I'm going back to school to become a doctor, all these were from God's messages, the things that God had connected with me in my life. I've seen with other people in my group that they've been prayed with and prayed over, and their values would go back up again, and things would happen. They'd go into remission, or they'd be feeling better. It's just for the coping situation of all. Just dealing with the condition itself psychologically, having God in your life gives you a sense of peace. And I'm not afraid to say the word God. It's a very frustrating situation in today's world when I see people are afraid of sharing their faith with other people. Believe me, we need God now more than ever. And that's what I'm trying to encourage people to know, that if you have God in your life, you can handle almost anything that you have to deal with. Yes, it's not going to be easy, but he's there to help you through it one step at a time.
It's unfortunate because sometimes when you do talk about, we're all sinners as we know.
Oh, I'm not perfect, honey. Believe me, far from it.
when you start talking about God, it's amazing how some people who do not have a faith get nervous, okay? Because they first of all, I've said this many times, Cindy, I don't care what denomination you are. Anybody who doesn't have any kind of religion in their life, I feel so sorry for them.
Oh, my God, I do too.
They have a void in their lives, and they can never be happy.
No, you can't.
You can never be happy.
You have that sense of peace that somebody's helping you manage. You know what? I'll tell you how I look at it from these scientist people out here. How I know about God. Since I've been taking science classes, when you see how our immune system works and how the whole body works, it's very intelligently designed. There's absolutely no way that this was just some random accident. Somebody with a genius mind had to put this together, the way the body interacts with each other. And I always said, God reminds me of oxygen or air. We can't see it, but it's there, but it keeps us alive. And the devil is carbon monoxide, odorless, tasteless, and colorless, but it kills you. That's how I look at it.
Very good. Folks, I'm talking to Cynthia Dolon, who is very active in the Lupus Foundation. We're going to try to get on the phone Dr. Andrew Newberg. Now, this guy is amazing. As I said, he's been on The Tonight Show. I mean, it's Good Morning America, Nightline, etc. And we're going to get him on the phone and talk about this, what he'll be talking about there, what will his presentation. You're all invited. Now, this event, okay, is going to be held. Tell us how people could get involved here.
Okay, well, first of all, you can send me a check, credit card, Or you could even go online and
How do they get in touch with you?
you could call me at 956-0072, and you also could send it to 722 Alta Street, Hazelton, PA.
All right, now you're going too fast.
Oh, I'm sorry.
Okay.
I talk fast because I'm an Italian
All
on
right,
steroids.
folks,
You
here's
got to
your-
understand that.
Andy is going crazy in the.
I'm
Andy,
sorry about that.
We're going to put a number on the phone. I'll give it to you.
Okay,
It's
956-0072. And
That's
you could,
the phone number I want you to call.
Yes.
We come back, we'll give you a little bit more information, folks. This is a great event. I'm going to try to get Dr. Newberg on the phone now. We'll be back right after this.
Okay.
Welcome back to the Sam Lesante Show, folks. Great show I have here today. But remember, folks, you can watch us 24/7 on ssptv.com. That's 24/7 ssptv.com. My email, sam@ssptv.com. Last month, folks, the month of June, over 1.7 million hits on our website. Thank you so much. Now, I have on the phone, folks, Dr. Andrew Newberg. As I mentioned in the beginning of the show, he'll be here on July the 24th and the 25th. What day will be here?
24th.
He'll be here on the 24th.
Yeah.
Dr. Newberg is a director of research of alternative medicine. Folks, you got to Google him up because it's fantastic what he has to say and what he's been doing. His theme will be the connection between God, your brain, and healing. Doctor, how are you?
Good, thanks. Thanks for having me on your program.
Oh, it's my honor to have you on the show, Doctor. You certainly do great work. Could you tell me a little bit about yourself, Doctor?
Well, my current position is Director of Research at the Myrna Brin Center of Integrative Medicine at Thomas Jefferson University. And over the past 20 years or so, I've been involved in a lot of brain imaging studies, actually, to look at the effects of different types of interventions, different types of complementary and alternative practices like meditation, prayer, acupuncture, and so forth, and how they affect the human brain, how they affect our body, and ultimately how they affect our overall health and well-being. And for me, it's been obviously a very exciting area of research. It's been something that when I first started out was pretty new in the area, and no one had really, we kind of understood that being religious or spiritual had an impact on the way in which we dealt with our health and well-being, but we never really understood some of the mechanism behind that. And that's where some of these imaging studies actually come into play, that we can see what's going on in the brain, ultimately see how it has an impact on the body, and how we might be able to utilize these different resources that we have as human beings, that spiritual side of ourselves, to help us be healthier and help us to be better people.
Now, Doctor, are you a medical doctor?
Yes.
Okay. All right. Now, something had to happen in your practices that made you go in to look at the neurotheology part of the of medicine, which I find quite interesting, because I think a lot of people, we were talking in the break, before the first segment of the show, about how important God plays in our life. And sometimes people, have a little tendency of saying it's taboo, it's whatever the case may be.
Right.
What brought you into this area of neurotheology?
Well, for me, it was actually something that began even when I was a child. I just found myself always asking kind of those big questions. Why are we here? How do we know what's real and what's right? Why do we think about the world and our reality around us in certain ways? And why do people have so many different perspectives on the way in which we understand our world, on God, different religions, and so forth? And I guess part of me realized that it had to have something to do with the human brain, and I was always very fascinated by science and the brain, thinking, well, if our brain is what's kind of processing all of this information that's out there and telling us, giving us a picture of what the world is all about, has to have something to do with the human brain. And so I was very interested in science growing up. But as I went through college and even into medical school, I started to explore these questions in more detail. I started to look at not just the scientific perspective, but that there were different philosophical perspectives, different religious and theological perspectives. And it really it was just this line of questioning that just kept opening up new doors and new ideas and new ways of thinking about things. And I guess I ultimately came to realize that while science is terrific and does a lot of wonderful things for us, it has its limitations in terms of what it can say about the nature of reality. Philosophy, religion, theology, and so forth, also wonderful and essential parts of human humanity, but also don't get all the way there because they miss some of the physical stuff that science tells us about. So as I entered into medical school, I realized that somehow I had to figure out a way of kind of bringing these two dimensions of the human person together, the science and the spiritual. And I was very fortunate when I was in medical school. I had several mentors who were just phenomenal, one who helped guide me through the imaging part, and then another psychiatrist who had been exploring a lot of these same kinds of questions about the nature of religious and spiritual practices and experiences in the human brain, even as early as the 1970s, although he didn't have the equipment to do the studies. So all of that just kind of congealed for me back when I was in medical school, where I realized that I really can combine these. I can find ways of linking together the best of what science can offer with the best of what we can understand philosophically, spiritually, and from my own personal perspective, all of this has been my both scientific and spiritual path, and I really look at it as kind of a combined path. It's not just scientific, it's not just spiritual, but it's really a part of what makes me who I am, and I just continue to explore these questions and have a lot of fun doing it, and love sharing it with anyone who's interested.
How long have you been doing this, Doctor?
Well, I would say, at least in earnest since medical school, it's been about 20 years coming up. I started to do a lot of brain imaging studies, more specifically looking at neurological disorders, things like Alzheimer's disease, Parkinson's disease, but then realized that, well, if we can image the brain and see what it's doing in whatever state, then we should be able to image the brain when somebody feels something religious or spiritual, when someone prays to God, when somebody speaks in tongues, when somebody meditates. And then we were able to do those kinds of scans and see exactly what was going on in the brain, and then use that information to help us in terms of better understanding the impact of these practices on who we are as people.
Okay, now tell me some of the success stories you've had with some of your patients that have been able to, look at this more of the connection, how God plays a part in their life in prayer. Have you seen some successes?
Well, I mean, I've certainly found that when people turn to their religious or spiritual practices, when people turn to going into prayer, saying the rosary, whatever it is that has deep meaning for them, that it really does help to improve the way in which they deal with whatever medical issues or even life issues that they're dealing with. And I guess I'm more of a researcher, so I tend to look at kind of things from a more global perspective. We have research studies where we've shown that doing the rosary helps to reduce anxiety. Doing different meditation practices, depending on what tradition you come from, helps to improve the brain's function, helps to improve your memory. And I certainly know people who, so many people who I have recommended that they go into more specific programs that involve meditation and prayer, where they say, yeah, that really, it changed my life. It really made a huge difference in the way I deal and cope with my illness, and the way I deal with my life. It's often extraordinarily transformative for people, and that to me is, you see that on an individual level, and then part of my goal is to try to understand it on the larger scale. How if we see that one person benefits, does that mean that we can apply that to everyone, and if so, how? And that's what we've been exploring over the last decade or so.
Doc, can you stay with us when I come back to my break? I want to ask you a couple more questions.
Sure thing.
Folks, I'm talking to Dr. Andrew Newberg, medical doctor, and he is the Director of Research of Alternative Medicine Clinic at Jefferson Hospital. His work attempts to better understand the nature of religious and spiritual practices and experiences, okay? And it's interesting, folks. Here's a medical doctor. He's an internal doctor, is internal medicine, and also he's board certified in nuclear medicine. What you see and how you cope in life, as we have Cindy here, Cynthia Dolon, who told you in the first segment how important it is that spirituality is a very important part of someone's life. As I said before, I really feel bad for those of you that do not have any religion whatsoever. You just have a complete void in your life. Science is one thing, but blending the both of them together, I think you have some great successes. We come back, we'll talk a little bit more with Dr. Newberg. Stay with us. Welcome back to the Sam Lesante Show, folks. My guest, Cynthia Dolon, who is from the Lupus Foundation. A great event coming up on Wednesday, July 24th. This is the event you want to go to. And you can give Cindy a call at 956-0072 for tickets. Now, one of the guests will be there, a keynote keynote speaker, is Dr. Andrew Newberg. And Dr. Andrew Newberg is the Director of Research and Alternative Medicine Clinic at Jefferson Hospital. Doctor, I just asked you before, you are of the you're of Jewish denomination, correct?
Yes.
Working with many of your doctors and what you do, how many of them are optimistic of what you do? How many are pessimistic? What do you find from your peer group?
I think I'm hopefully not completely naive, but I've been very fortunate. The path that I have taken here is to really try to look at how science and medicine can interact with spirituality and religion, and I think most people have come around to appreciate that. Most physicians, just because of what they have had to dealing with people on this very, very fundamental level, especially when people are in need of help. I'm sure every doctor in their career has been asked to pray with a patient. We recognize, I think there's a growing recognition that we have to do a better job than simply trying to take care of the biological thing that is the human person, that we are social, we're psychological, and we're spiritual beings. And obviously, every person has different perspectives on that. Some people are very religious, some people are not very religious, and we need to be able to find ways of finding out what kind of impact religion and spirituality has in a person's life, how it affects their overall health and well-being, and then ultimately how to help them to take advantage of the belief systems that they have. And if you're, even as you mentioned, even if you don't believe in religion per se, that doesn't mean that you can't take advantage of certain practices like meditation and so forth to at least get some benefit from that, even though it may not be the same as somebody who is deeply religious. When I start to really look around and see how people have started to understand it within the healthcare setting, the importance of spirituality, of all the different ways in which we can help heal a person, they've really come to realize that spirituality is an important element there, and we need to find better ways, more effective ways of getting to that. And that's part of the thing that just it's not really there right now in medical schools. So people kind of come out as doctors and not really knowing how to ask the questions. Even what's the best way to approach the topic with somebody? We're often so concerned about doing that. And part of it is that we just haven't even been given the skills and the tools to learn how to do that effectively. So that's also part of what a lot of the work that I'm involved in is really geared towards trying to do.
Doctor, briefly, tell me about your book, and then I have about 3 minutes left. I want to talk about what your presentation will be at the event on July 24th. But your book, Words Can Change Your Brain. Tell me a little bit about a minute about your book.
Well, this grew out of some of the work that we've done. We've understood that different practices like meditation and prayer often use words, and these words deeply affect the human brain. So we thought, well, is there information that we can now take from those studies and find better ways, more effective ways of communicating between a doctor and a patient, communicating between one person and a friend or a spouse or a family member. So we've started to put together a whole program to help people try to be able to communicate more effectively, to create more intimate dialogue between each other, to understand each other better, and to not be as reactive to each other. And that's really what we outline in our book, Words Can Change Your Brain, which is how does that happen and how does that ultimately play out in the human brain? How does it affect us? How does it make us feel more anxious or less anxious if we use different kinds of words? And there's really a lot for everyone to learn about in terms of being better communicators. And
I definitely need the book because I'm very interested in what you have to say. Your presentation at this event. Now, folks, what I'm talking about, the Lupus is having their 10th anniversary celebration dinner dance. And you can get tickets by giving Cindy a call at 956-0072, folks. Dr. Newberg is the keynote speaker. Doctor, about a minute left. What are you going to be talking about at this presentation?
Well, I think obviously a lot of the focus will be on chronic illness such as lupus and how spirituality and religious beliefs and practices have an effect. What is the effect? What are the positive effects? What are the potential negatives that we have to watch out for? We'll be talking a lot about. I'll be talking a lot about the brain imaging studies and the other clinical studies that we've done that have shown how meditation, prayer, other types of spiritual practices can ultimately affect the brain, affect the body, and how they can be beneficial for individuals. What are the tools that they can take from that? What are the things that people can utilize in order to help them deal better with the various issues and illnesses that they may face? And obviously there'll be a lot of support from the research side, but also a lot of practical tips on how to utilize this information in an effective way for people.
Doctor, stay with us a minute. Folks, I'm talking to Dr. Newberg, Andrew Newberg. Now, if you want to go to his website, it's andrewnewberg.com. I highly recommend you go into his website and buy the book. I'm telling you, books. I could see it's a great book. Cindy, I want to thank you for coming on the show.
No problem.
And thank you for introducing
Absolutely.
us to Dr.
He's
Newberg.
a great man, and you're a great guy, too.
Thank you very much. But anyway, folks, if you could help out the Lupus Foundation, it's helping everybody out. It's not only for lupus, but it's helping us out. It's a great opportunity. Cindy's been a great person promoting this. And look at, she's doing well. She's going for a doctor's degree. And it's just a nice success story. Remember, folks, 24/7, ssptv.com. You can watch any of our shows. Thank you so much, folks, for the reaction we're getting on our 5 o'clock news. The Girls Show is just continuing to grow every week. It's over 160,000 people watching the Girls Show every week now. The Sam Lesante Show is up to 170,000 people. Our news is at 70,000 people per day, weekday, Monday through Friday. We want to thank you so much for your participation. Of course, our media sponsors, the Standard Speaker, have been great to us, and it's just an operation that we're able to provide to you, the community. Thank you for having trust in us. We'll see you next time.